I can't think of a better lead-in. It's almost like we would have planned it. I didn't know exactly what he was going to say, but speaking from the heart, but it takes us right into our next topic.
Right, absolutely. Behavioral health and education integration has been a key initiative in our state in recent years.
Yes, when we started doing our governor's conferences on innovation and education, we got together with our team and with Superintendent Baesler, who's the independently elected superintendent of public instruction in North Dakota, and we said, let's get together with all of the group of superintendents and say what's their most important thing on their mind. And they said, you know what they said? They said behavioral health.
Wow.
Because that was the number one thing. So when we had our conference a year ago, we actually had a 2-day conference. One entire day of the K-12 conference was focused on behavioral health. And coming out of that with the legislative support, there have been several efforts that have been initiated in the state.
From prevention and early intervention, school pilot implementation and expansion, to the development and dissemination of resources and funding to support students' behavioral health.
Let's take a look at here from Mindie Bopp. She's a school counselor in rural Sargent Central High School, which is in rural North Dakota, down in Sargent County. Interestingly, it's kind of in the center part of Sargent County, because there's also North Sargent.
Good to know. Is Milner in Sargent County?
Yes. So
that's where my grandparents are from.
Yes, we'll fact check that, but
it's true.
Nelson Implement in Milner, North Dakota.
That's right.
Grandpa Elwood. Okay. Anyway, but to hear the impact that they've been having and how they're applying some of the insights that we just heard about from Dr. DeLisi and applying it in their school. Here's Mindie.
Hi, I'm Mindie Bopp. I'm a counselor for grades 7 through 12 at Sargent Central Public School in Foreman, North Dakota. Sargent Central Public School District was consolidated in 1962, and it's comprised of 6 rural communities: Brampton, Cogswell, Foreman, Rutland, Havana, and Cayuga, with our overall district population of around 925. Our current pre-K through 12 enrollment is 172 students. So along with providing mental health services at Sargent Central, our counseling program is also responsible for the academic, personal, social, and emotional development. So while there's many aspects that we truly love about being a rural, close-knit community, one of the difficulties that we see is having access to quality mental health care. Most students and families aren't able to leave work or school for their appointments. Insurance coverage and the billing of mental services is oftentimes daunting or overwhelming. So the overall goal at Sargent Central was just to bring in the mental health services to our students by eliminating the transportation and the complexity barriers that come with it. So in addition to doing that, we wanted to bring those services closer to our students. We wouldn't have had the financial capabilities to do this if it wasn't for the funding from nonprofit organizations in North Dakota. With their funding, any student who does not have health insurance would not be denied these critical mental health care services. So at Sargent Central, we are in our 2nd year of the school-based mental health program. The services that are received are provided in collaboration through the Village Family Service Center of Fargo. Since the partnership began with the Village, we've serviced about 10 students. And then the impact that the services have had, the results have shown to be remarkable. The Youth Outcome Questionnaire, or the YOQ30, provides a total score that just indicates the student's overall behavioral and emotional distress in their life. The critical items would then alert the clinician to potential high-risk behaviors, such as suicide or substance abuse. The higher the score, the higher or the greater the impact for impaired functioning. So I'm happy to report that at Sargent Central, 100% of our students who have participated in the Village mental health services have all showed improvement in their functioning as measured by the YOQ30. But more importantly, for our students at Sargent Central, we're seeing an increase in their attendance at school. We're seeing an increase in the way they're able to communicate with their teachers and their peers. And overall, from all of our stakeholders, the feedback has been very well received. Many, and myself included, can wholeheartedly say that this is a program I wish and love I wish we would have started it earlier. I encourage any teacher, parent, student, and community member to check what mental health services are available to your students in your community, especially these rural North Dakota communities. For Sargent Central, it's truly made a world of difference for us to be able to offer these services here. I encourage all counselors, school administration, and all school board members across the state to find a way to implement these mental health services in your school.
Thank you, Mindie, and thanks for sharing the successes you're having there in Sargent Central. And again, thank you to your partners, and thanks to the philanthropic funders, some of whom have chosen to remain anonymous, but I know some of them, and they're doing great work, and appreciate everything they're doing for our rural schools. It's great to see that integration with behavioral health directly into the K-12 system. We can, as we've talked about at the conference, the education conference, we've got the resources to put school resource officers in most schools, which are police officers around the country, and this is great, but if they're there they're trained in law enforcement, they're not trained in behavioral health.
Yep.
And if we're introducing young people with a lot of ACEs
Yep.
to a police officer in a school setting, then sometimes that's what's called the school to prison pipeline. And what we really want to do, if we can afford that as a state, we can afford to have behavioral health in all of our schools, so that if a student's got a health issue, they've got issues at home, we can get them introduced to the help they need, and we can train all of our school administrators and teachers to understand that these are health issues, and we can treat the health problem as opposed to having a consequence for the behavioral issue. And because consequences don't change behavior necessarily if the root cause is a health issue. We've heard about from the two brain scientists today,
Yep.
talking about how when the brain is wired to do something, sometimes consequences aren't going to change that behavior.
Right, and you know, that's not to say that school resource officers aren't
amazing.
Yeah, because they are amazing. I mean, I met one out of Western North Dakota, and he was gigantic, you know, and I thought, gosh, he must be had a gun and a vest and everything, and I thought, he must be kind of intimidating for the kids in the school. But the kids love him, you know, because I think they do become, you know, friends and mentors, and you know, they play all kinds of roles, but they may not necessarily be the person a young person needs for behavioral health challenges. But
Exactly, and you've hung out with school resource officers who are rappers.
You
You've
have,
gone on
yep,
tour with them,
right?
the first lady in the rapper tour. I mean, you've got, they are great. They're
I wasn't
amazing.
rapping.
We love our school
goodness.
resource officers. Let's surround them and give
Yeah.
them the support, and our principals and our superintendents and teachers additional the behavioral health support. It's and, not or. We need
Right.
both.
Awesome, yeah.